Hello, and on behalf of the Mental Health Faith Council, we welcome you to a series on coping with COVID, a lunch and learn opportunity. Today we have Gretchen Hyatt, who's parish nurse at Grace Lutheran in Toledo, and Jeff Bischoff, who is the senior program clinical manager at Lutheran Social Services, and they will share a little bit more about themselves as they speak. But we are going to get started here with Gretchen's slides.
Good morning. Yes, I'm going to talk a little bit about the medical aspects of COVID and how they affect us. And I've been a nurse for about 40 some years and a parish nurse here at Grace for a little over a year and a half. And we're going to move on to fact, fiction, and we just don't know about COVID. One of the things is a lot of people are looking at COVID and the flu. There is a source called SAMHSA Alliance, and they say the flu, exposure can pass to 1.5 people. With COVID, if you have the symptoms, you can pass it on to 2.5. So there's a lot of significance there. And 80% of the people have mild symptoms. They're still saying 1 in 6 are developing more symptoms. And I was told the other day that I shouldn't put any numbers in this, but you still need to have a few more facts. One of them, as of this morning, there's almost 28,000 cases in Ohio. And right now we're getting up there around 1,600 deaths from COVID in Ohio. Next slide. Next slide.
I'm trying. Why is it not moving? There we go.
Okay, there's our update on our flu exposure and our COVID-19. Next one. Okay. Some of these symptoms that can appear typically within 2 to 14 days. One of them is a fever. I have a fever of greater than 100 degrees. Some of the newer research says 100.4 or 38. A cough, it can be typically a dry cough. The shortness of breath and the difficulty breathing is one of the key symptoms we seem to see. Chills, repeated shaking with chills, a lot of muscle ache, pains and aching, headaches. Some people say they're really, really severe. Another unusual one is a new loss of taste or smell, and extreme fatigue. People are feeling exhausted. The CDC has on their webpage, as well as some of the other sources now, a self-checker guide. You can go through that and check to see if your symptoms look like symptoms that could be COVID-19. Next slide. There's a CDC. All right, next one. The best way to prevent it is to avoid exposure. Next, please. Transmission is person to person. Respiratory droplets, we cough, we sneeze, drops, someone else inhales them into the lungs, and that's where we get the respiratory symptoms that we're seeing. People in close contact, that's why the distancing is so important. And the key thing is you may be carrying COVID, but you don't have any symptoms, and that's difficult. Next slide, please. Hand washing is one of the biggies. Wash with soap and water for 20 seconds. If you can sing 2 choruses of happy birthday, you're good. Not a quick run under the water. You really need to wash them well. And every time you're in a public place, grocery store, after using the bathroom, touching food, much more conscientious about it than we've been in the past. Hand sanitizer is good if you don't have any soap or water, but it needs to be at least 60% alcohol. And you need to use it so that your hands actually are dry. Just put it on and let it run with wet sanitizer. And the other big thing is avoid touching your face, your eyes, your mouth, and your nose with unwashed hands, or just touching them, period. Next slide. And avoid close contact. People are sick even if they have cold symptoms. We don't know for sure. Physical distancing or social distancing, the 6 feet away. And again, the people that may not have the symptoms. People that are at high risk, people with heart problems, lung problems, they're being treated for cancer. You have immune compromised people, people that are on certain medications. Those are really high people that can get COVID easily, high risk, and there's a lot of our parish members. Handshakes are gone. I think Governor DeWine said they're dead. Wave, high five, nod, bow, whatever. And basically most of our parishes are closed but looking at reopening. But again, if you're sick, shouldn't go. Funerals have been dealt with a number of different ways, either not at all by the church or the parish, graveside burials, or the other thing is a lot of people are planning events later, memorials later in the year. Next slide. Face mask. The mask is meant to protect people, and it's also from you maybe having the COVID and breathing on someone else, but it also works the other direction. Ohio's not mandating face masks, but very strongly encouraged, and the CDC is strongly recommending them. A lot of stores now have signs, face mask preferred. Children that are 2 and under and those that are not capable of removing a mask should not be wearing them. And the N95 masks are the ones that are used for healthcare workers, and those we really shouldn't be using. Use the cloth masks that are more and more readily available. One of the big things is a lot of people wear masks that they're wearing the mask, but they're not covering the nose. Really isn't effective. You're still breathing in the droplets, so it needs to cover the nose and the mouth. And people keep wearing fabric masks. They need to be washing them. And they also do not replace the need for physical distancing. Next slide. Coughs and sneezes, no tissues, cough or sneeze into your elbow. If you use tissues, get rid of them as soon as possible and wash your hands or use your hand sanitizer. Next slide. Clean and disinfect. Cleaning is using soap and water on visibly dirty surfaces. Disinfecting is when you're using a disinfectant. It's frequently touched surfaces, your cell phone, your door handles, car handles, your checkout. If you're checking out of a grocery store, you use the card, put your card in, and you have to post your numbers. That is really important. The CDC's come out with some really important guidelines for what products work well, how to make your own products. You need to be familiar with those, although some products are starting to reappear in the stores again. Food items, the CDC is saying that food items are not affected, but to use your normal washing of what you would do, fruit and vegetables or apples, when you get them home. Gloves, next one. The World Health Organization, or WHO, recommends that you don't wear gloves. Part of the problem is that, yeah, you have the gloves on, but people still touch their face. And a lot of it is too, people don't know how to correctly remove gloves so that they're not transferring bacteria, or they're reusing the gloves, which really defeats the whole purpose. Next slide. Fiction. Okay, we're getting information overload. I think we're already getting data or information that in the fall we're going to have another reoccurrence because, and it's going to be severe, but we have the COVID and then we have our normal flu. So taking that into consideration, this is where you need to back off somewhat from the news if it's really bothering you. Reliable sources. There are so many crazy things out. I saw references to hot peppers curing COVID, that houseflies carry COVID, that if you can hold your breath for 10 seconds or more, that you don't have COVID. if you're not coughing or short of breath. The other thing was mosquitoes are carrying COVID, and radio waves. So there's all sorts of crazy stuff out there. So the most reliable sources are the CDC and Governor DeWine and Dr. Amy Acton's resources when they present. Next. And we just don't know. The testing is getting to be, more testing sites are available. They're doing 2 types of testing. Viral testing is the nose pharyngeal to test whether you actually have it. There's antibiotic testing to see if you have had it. And we don't know if the antibiotics that are being built after you have it are going to be effective short-term, long-term, lasting to next fall. That hasn't been determined. Vaccines, as you know, they're working on a lot of the vaccine possibilities. Convalescent plasma is plasma being taken from people who have had COVID and recovered. And still the results seem to look like that may work, but it isn't definitive. The anti-malarial drugs, still not definitive on those either. Physical distancing, I think that's going to be going on for quite a long time, as well as the masks. Next, please. And this is an ongoing thing, and when will there be enough toilet paper? Although I think toilet paper is now recovering, and we are seeing toilet paper in the stores. Next. And the big thing is to take care of ourselves, take care of our immediate family, and to take care of our parish family. As far as your parish family, you have to develop plans for reopening or how you're going to deal in the future, whether it be this emergent situation or a future emergent situation. So that is really important to get that going. Next slide. And these are some other resources that are available, and they're updating these on a regular basis. I just saw another update for reopening in relation to congregations or parishes. Health Ministry Committee, if you're lucky enough to have one, or you have a parish nurse or a nurse who's willing to work, take advantage of that population. And again, PPEs are still somewhat difficult to find in bulk. They're limited, so it's important to be out there and looking to see what's available. And thank you.
All right, thank you, Gretchen. And we will then move to Jeff. There we go.
Thanks, Gretchen. Thanks, Sherry. My name is Jeffrey Bischoff. I'm both a pastor and a licensed social worker and a licensed professional clinical counselor. I've worked for over 30 years in parish and outpatient mental health situations. And right now I'm at Lutheran Social Services, where I am the senior program and clinical manager. And I also take care of a small congregation in Williams County, up in the northwest corner of the state of Ohio. So get a lot of experience seeing this thing from a lot of different aspects, a lot of different angles. And as I have thought about what's going on with COVID and meditating on it and reading what other people are writing and what other people are thinking about the situation, it comes to me that this really is a situation of trauma. You can go to the next slide. And to think about it that way, I'm thinking about the SAMHSA definition of trauma. SAMHSA stands for Substance Abuse and Mental Health Service Administration. It's a United States government entity that sets standards for mental health and substance use disorder treatment. SAMHSA's definition of trauma is an event or series of events or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. So there are three, and you can see the reference down there at the bottom if you want to find out more about SAMHSA and trauma. But there are three key factors in trauma. That's the event, which is experienced, that has the long-lasting effects. I think we all can agree that this COVID-19 thing is quite an event. It's something that's been being experienced all over the world. I don't know that anything in the history of the world has been experienced similarly throughout the world as this pandemic is being experienced. So that is the event, definitely is being experienced, and it definitely is something that threatens our physical health and our emotional health and even our spiritual health, with the physical threat, with the threats to our bodies, and the emotional threat being the fear and the anxiety, the depression, dealing with this experience and all of the pandemic restrictions we have can result. So it definitely is an event. It definitely is experienced as emotional, harmful, or life-threatening. And the effects is what we really want to focus on today, because although we are affected by what's going on, what will determine whether or not this turns into long-lasting trauma for us and for others is how long-lasting and how adverse those effects really are. So traumatic and stressful situations bring out all sorts of feelings, thoughts, and behaviors, some which are helpful and some which are harmful, some that make things better, some that makes things worse. And some of the feelings, thoughts, and behaviors that make things feel better in the short term can make things worse in the long term. Next slide, please. The key to managing traumatic experiences successfully is to manage those feelings, thoughts, and behaviors resulting from the experience in such a way as to keep from experiencing trauma effects long term, which means managing feelings, thoughts, and behaviors associated with the trauma in positive, effective ways. And that brings us to the definition of resilience. A person's level of resilience, strength of resilience, type of resilience can really determine how long lasting and how severe the effects of trauma are going to be for that person or for that group. Resilience has lots of general definitions, and if I put them all together, I come up with this as the ability of a person, family, organization, or community to cope with and adapt to challenges or setbacks. There are different factors that determine the character and the strength of resilience, and those include problem-solving skills, self-regulation, and positive support. So we want to be able to address problems effectively. We want to be able to manage and control ourselves in a positive way and an effective way. And we want to make sure that we continue to receive positive support, both to give and to receive that from other people. So having those three things in there, we are going to be able to positively adapt in the face of adversity. Positive adaptation is all about healthy thoughts, feelings, and behaviors. And it leads to the question, how am I going to come out of this a better, stronger person? Positive adaptation derives both from past and present experiences of managing trauma. So how I have managed traumatic experiences in the past, how well I've managed those, what I've done to manage those, that's going to have an effect on how well I manage a present situation of trauma, and even what I'm doing now to manage the traumatic situation of the COVID-19 pandemic is going to determine my level of resilience. It can either get healthier or it can get weaker. Resilience has individual levels, small group levels, and large group levels, but it all starts with the individual. That we as individuals taking care of ourselves and then reaching out to those closest around us. As the individual's resilience improves and that individual shares positive support with other people, that small group's resilience is going to improve. And as each small group's resilience improves, it has an effect on the larger society. For this purposes of this presentation, we are looking at resilience of self, resilience among colleagues, pastoral colleagues, and the resilience of our faith communities. So when we start with the self, go to the next slide, please. When we're talking about self-management, we want to gain and maintain an appropriate sense of control within a situation that we are not in control of as individuals. Basic factors in gaining and maintaining an appropriate sense of self-control are physically calming the body and the mind. When we experience a threatening experience, when we experience a threat, our bodies go into that well-known fight or flight mode, and things get all excited in our bodies. And the more excited our bodies are, the more tense our bodies are, the more frightened and fearful our bodies are, the more difficult it is for our mind to think through and engage in that effective problem solving that adds to resilience. So we want to make sure that we are first physically calming the body so that the mind can also calm down. Then we can define what is or is not in my control. The well-known serenity prayer can be helpful here. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. We can sort that out, because if we spend a lot of time trying to have an effect on things that are out of our control, we're only going to get more and more frustrated, more and more fearful, more and more depressed. So we want to focus on what we can have a positive effect on, and then courageously address those things that we have appropriate control of. So then, once we've calmed ourselves down and we determined what we can address and what we can have a positive effect on, we can think through the situation and identify possible approaches for managing the situation positively and effectively. So next slide, please. Once again, starting with keeping ourselves calm, keeping our minds and bodies healthy and calm. Activities that are both calming and physically effective are important to engage in. Things like taking a walk, running, exercising in the home. If you remember gym class, at least forever ago when I was in gym, we did calisthenics, jumping jacks and toe touches and stretches and things like that. If you can't do anything more, at least you can try to remember what you did in gym class, and you don't have to do it with people watching, so you don't have to be afraid of how you might look or how you might do. Deep breathing exercises are really important for calming the body and the mind. Deep breathing from way down below in the diaphragm, slow, controlled, deep breathing is the single most effective thing we can do to calm our bodies. Dancing, singing, playing musical instruments, any kind of meditation activities that also involve movement, things like yoga, humor, laughter. We have to remember to laugh and to have fun and joke around, even though we're in a serious situation. It doesn't minimize the situation if we still take time and enjoy ourselves. It's important for us to do that. And cooking delicious and nutritious meals, taking that time that we have, not driving into work or being off work if you are off work, to look into that. Next slides, please. Important in self-care also are activities that maintain a sense of rhythm and appropriate control in our lives. Things like maintaining spiritual disciplines, including prayer and worship. If you had a spiritual discipline before, make sure you keep it up. And if the COVID-19 pandemic restrictions have created barriers for that, find new ways to do those, but to keep it up. Maintaining a regular schedule while you're working from home. Avoid the temptation to, when you're awake at 3 o'clock in the morning, to start working on that report or that project that needs to get done and then being tired all day. Keep a regular schedule with family members, friends, and colleagues. Find creative ways to continue regular activities with yourself and others while maintaining a safe physical distance. When working from home, continue to dress up as if going to your regular place of work, and not just from the waist up. That's a little bit of cheating. And when working from home, it helps to have a boundary and to create a designated workspace so that it doesn't overflow into all of your life and create more stress and anxiety. So to sum up on the next slide, in self-care, it's important to remember to do the above as much as is possible. Avoid telling yourself, I can't do it, which increases the stress. When we tell ourselves, well, I can't do it like this person, or I can't do it perfectly, what we're doing is we're increasing that sense of, that out of control sense that we have. But instead, if we ask ourselves to what extent we can make it happen, that increases an appropriate sense of control. I spent 10 minutes moving today. I wanted to spend 15 minutes. I didn't make it 15 minutes. The phone rang or I had to do something. That's okay. It's okay. That's what tomorrow is for, to try to do better. So the next slide, please. Even though we are doing the best self-care we can, it's still normal to experience symptoms of anxiety and depression in stressful situations such as these. Some of those signs of anxiety and depression are trouble concentrating or focusing, trouble remembering things that you normally don't have trouble remembering, trouble going to sleep or staying asleep, or sleeping too much, getting enough sleep, which is 7 to 9 hours a day, but not feeling rested, having dreams, nightmares. There's this phenomenon I hear about, COVID dreams that people are having. Feeling disconnected from reality, like you're living in a dream and you're not sure what's real and what's not. Increased irritability, restlessness, or feeling on edge. If you're experiencing difficulty, if you're having difficulty experiencing positive emotions such as love, happiness, joy, and satisfaction, or experiencing a lot of muscle tension, these are signs that you're experiencing some anxiety and depression. Now, like I said, in a stressful situation like we're in, it's normal to experience signs of anxiety and depression. And that's why it's important to keep up with that self-care and those coping skills, and to encourage those close to us to keep up with self-care, because they keep these symptoms of anxiety and depression from getting too far out of hand. But, next slide. Sometimes everything that we're doing doesn't work. We're still having trouble sleeping. We're still having trouble focusing, concentrating. We're still irritable. So it's important to seek professional help when it reaches that point, when anxiety and/or depression cannot be managed by regular coping skills, or if you're beginning to try to manage anxiety or your depression in unhealthy ways, such as using alcohol, marijuana, or other unprescribed substance to self-calm or lift your mood, or any type of risky behavior such as risky sexual activity, you get into those things, it's time to pick up the phone and find some help. You may be sharing your thoughts and feelings, frustrations inappropriately, such as on social media, or crossing boundaries, which is sharing with people with whom you should not be sharing such things. If that's happening for you, please pick up the phone and talk to a professional and see if you can get some help. If your family members, friends, colleagues, and/or supervisors suggest you look into getting professional help, it's a good idea to do so. And when your home, school, or work life begin to be negatively affected by your experience of anxiety and depression symptoms, it's important to pick up the phone and call and get help. So that's the self-care level. And we go on to the small group level. We're looking at caring for one another as colleagues. These are important things to do. We can in this situation, some things we can do are to check in with one another through established relationships, such as leader groups, or through establishing new groups. We can create a list of people to contact individually on a regular basis. Lucas County Mental Health Board recently came out with a Strive for 5 initiative where people identify 5 people to contact and check in with. And when you're just talking, make sure you do a COVID check-in with each other. Specifically ask, how are you doing with this? How is your family doing with this? How are the people in your faith community dealing with this? Do you know anybody who's sick? Do you have anybody who's died? And so that we can make sure that we address those anxieties and issues of sadness and grief with one another. You can participate in self-care activities as a group creatively, such as doing meditation or relaxation exercises while connecting through the telephone or internet, and appropriately share thoughts and feelings, which results in a sense of normalization. I'll go back to the COVID nightmares that people were having. Each person having those nightmares thought that they were odd, thought that there was something terribly wrong with them, that they were having these nightmares, until they started talking about them, finding out that other people are having these nightmares too. And we find out that it's a much more widespread phenomenon. So having cared for ourselves, having cared for one another, we look to caring for our faithful in our faith communities on the next slide. We can share thoughts and feelings appropriately with faith community boards, councils, again, normalization. If you're Zooming in for a council meeting or a committee meeting, you can do that COVID check-in. You can ask people how they're doing. You can ask people if they're struggling. And if someone starts sharing a little too much, you can invite them to, hey, I'd like to talk to you more about that. Let's set up a time so that we can talk more individually. You can develop a plan for reaching out to your people and maintaining contact, which a lot of faith communities have already done and are doing very well, including sharing information on coping and resilience and working toward building resilience for individuals, families, groups, and the community as a whole. How can we all get through this together and be better on the other side? And we, at the time that we had this Lunch and Learn, we had another event coming up on May 7th, looking ahead and moving forward, but that event has passed already. So most importantly, I want to express thanks for all the important work you are doing on behalf of your faith communities during this challenging time. Remember, the work we are doing is important. The work we are doing is making a significant difference. We may not be seeing much of a difference, we may not be feeling much of a difference, but the fact of the matter is, even if it doesn't look like it, God is working and the Spirit is moving and getting us through this thing all together. So thank you very much.
Thank you, Jeff. Again, on behalf of the Mental Health Faith Council, we thank you for participating. There are other Lunch and Learn links on the Nami website. That's the National Alliance on Mental Illness. And if you have any questions, you can give the agency a call at 419-243-1119. Take care.